The head of the CDC says she is, quote, deeply concerned about the trajectory of the coronavirus pandemic. Cases and hospitalizations are moving in the wrong direction. Infections in the U.S. now tally more than 30.1 million, and more than 547,000 lives have been lost in this country alone. More states say they will be opening up vaccine eligibility to all adults by next month. As of Friday morning, nearly 15% of the population was fully vaccinated. Carter Evans reports from Los Angeles.
Tonight, worries over another wave, with COVID cases on the rise in nearly half the country as states reopen and students celebrate spring break.
And we know from prior surges that if we don't control things now, there is a real potential for the epidemic curve to soar again.
This comes as a new study at select college campuses will monitor vaccinated students and their close contacts.
We'll be able to answer the very important question about whether vaccinated people get infected asymptomatically, and if they do they transmit the infection to others.
Rutgers University in New Jersey will now become the first known college to require students to be vaccinated before returning to campus in the fall.
I think that's a great idea because we've had over the last year about 500,000 college students get infected. And there's been about 100 deaths linked to outbreaks on college campuses.
More states are now expanding eligibility for the vaccine to all adults.
The news that I think all of us have been waiting for, all Minnesotans aged 16 and above will be eligible to receive their vaccines.
47 states and the District of Columbia say that'll happen by May 1st at the latest. Just 3 states, New York, Arkansas, and Wyoming, have yet to commit. And as the country waits for the pandemic to end, there are still hopeful moments to hold on to. 39-year-old Alfredo Hercules beat COVID after spending more than 70 days in a New York hospital, finally getting to hug his family.
I haven't seen him in close to 3 months. Just happy and blessed to be home with my girls.
Today, they plan to vaccinate about 2,800 people here, and they hope to have enough vaccine next week to ramp up to their full capacity of 4,000. And they are going to need it because California is allowing everyone 50 and older to get a vaccine starting on April 1st. Lana?
Carter, so great to see those families reunited. Thank you. And Dr. Teresa Amato joins me now. She is the Director of Emergency Medicine at Long Island Jewish Forest Hills in New York. Dr. Amato, thank you for being here, and thank you for all that you do. So more states have announced plans to expand vaccine eligibility to all adults as soon as mid-April. This is very exciting. Is this actually, though, a game changer? And do you think that supply will be able to keep up with that demand?
So it's very exciting. Each day brings what seems like hopeful and really good news as far as the vaccines are concerned. I'm very thrilled professionally and personally to have them lower the age group. I'm the mom of 6 children, so I'm excited to see what they're going to be doing with children coming probably in the fall. But yeah, every day brings some good news about the vaccine. So it sounds like the supply is going to be able to cover them. It sounds like many states have committed to trying to get everyone 16 and over to be eligible very, very soon. And so I think this is all good news. I think the quicker we can get this into people's arms, the better the spring, the summer, and the fall is going to be for all of us.
So you're a mother of 6. Hats off to you. I'm a mother of 3. Let's talk about children because they're not yet eligible for vaccines. Trials are underway, but it could be next year until they're actually able to receive shots. Does this mean that we could still see kids and families with younger children having to follow these strict protocols?
So there's still a lot to be looked at when it comes to younger folks and COVID vaccines and their symptoms and their illness. It seems to be quite different than their older adult counterparts. So exciting that the major groups, Pfizer's starting to look at some studies looking at children. So we really don't have enough data yet to know what is a safe and effective dose of the COVID vaccine, but it sounds like they're really working on that right now. I don't anticipate that's going to happen too soon because we really need to get the data back, but they're doing a pretty large study looking at children. So we'll have to see. My sort of guess is children will probably be more like the fall time, maybe September, October, November, when they'll start to become eligible for the vaccine.
All right. Let's talk about asymptomatic COVID, because that continues to be a huge concern. And scientists at the National Institutes of Health have launched a study on asymptomatic COVID. They're going to be tracking the virus in thousands of vaccinated college students. Tell us, what are researchers hoping to learn?
So there's been a lot of controversy over whether people who are testing positive but have absolutely no symptoms, if they are actually contagious. One of my thoughts is that sometimes I've had patients who didn't really correlate what they were feeling to a necessarily a COVID infection, just generalized weakness, just feeling kind of tired, not feeling themselves. And when they turned out to be COVID positive, they were just really surprised. So we're just not sure if it's completely that they're asymptomatic, they have no symptoms at all, or their symptoms are mild, or they're not contributing their symptoms to COVID. So I think this study is going to really help us figure out what to do with especially younger folks who are asymptomatic, because it really does impact their schooling, their isolation. And so we would really like to know, but like the rest of us in medicine, we really want to chase the data, not just anecdotes. So this study is going to be really helpful for us to be able to really explain to families what to do with their children if they have asymptomatic COVID infections.
You know, it's interesting, Dr. Amato, because it feels like there's so much promise. There are all these studies that are taking place. The vaccinations are going up, and yet there's still so much that we don't know. And Dr. Fauci actually says that the U.S. has not yet turned the corner on this pandemic, which I think is going to be surprising to a lot of people. So what are the challenges that we still face?
So, interestingly enough, I'm very excited about the vaccines. I'm really excited about, what's coming down the pike. But in my professional life, I have not seen the big dips and decrease in cases. We're not being inundated like we were a year ago, but we certainly are seeing daily several patients with COVID infections, symptomatic COVID infections, and some still quite sick, and unfortunately some, especially at-risk patients, unfortunately dying from this disease. It's very frustrating, although I will say most of the time when I speak to people, they can pinpoint back to a time where they were in a group or around some folks without a mask on and weren't following social distancing. So, I just keep telling people, if you really have someone in your home that's very vulnerable, it's really up to you to do your job to make sure you don't make your family member sick, even if you're not in an at-risk group. So, the other concern is spring break, quite frankly. I've been watching the news like everyone else, kind of shocked and a little bit anxious about some behavior I've been seeing. I'm really hoping that that does not become a super spreader, because it would really be terrible to go 6 steps back when we're really moving forward.
Yeah. Well, Dr. Teresa Amato, always appreciate you coming on and answering our questions. Thank you.
Thank you.